ADHD is when person has attention deficit and hyperactivity or impulsivity. It's not a disease, but it's not a laziness also. It's when there is clear biological and brain-based mechanisms. This condition starts in childhood, and in most cases it continues into adulthood. Symptoms may change with age, but the core difficulties usually remain. The main problem is that when a person is not treated and has ADHD or attention deficit hyperactivity disorder, they often develop significant life problems. For example, in men, ADHD is associated with 3 times higher risk of frequent job loss, lower educational level, 2 or 3 times higher rate of alcohol use and substance use. There is higher risk of legal problems and financial instability, impulsivity, poor planning, and difficulty with long-term consequences. In women, attention deficit is strongly associated with chronic anxiety, 3 times higher risk of depression, low self-esteem, emotional eating and eating disorders, dependency or relationship instability. It's also common that women are diagnosed later in life because they mask the symptoms in childhood. The majority of cases of ADHD is genetical, 70% of cases. So a hereditary component is very strong. Some associations exist: maternal obesity, maternal diabetes, low birth weight, premature birth, maternal smoking during pregnancy. They are risk factors, but not direct causes. Mechanism is that ADHD people have lower dopamine level in the brain, and they have low motivation, low reward anticipation, and task initiation. Because this task without immediate reward feel physically hard. The brain response is often, this is boring, low dopamine signaling, and avoid. So person avoids tasks because low dopamine. The person may want to do tasks, may understand its importance, but cannot initiate it. People with ADHD also have low norepinephrine. It is responsible on attention regulation and mental alertness and working memory. And that's why people with ADHD have difficulty for focusing, mental fatigue, and poor concentration. In childhood, boys usually have hyperactivity, constant movement and hyperactivity. He can stay still in class, rocks the chair, taps his feet, climbs on furniture. The teachers often say he never stops. Common misinterpretation is that this is bad behavior. It's not bad behavior. It's self-stimulating to stay alert. Children usually have normal intelligence, normal or above normal intelligence. It's very common, but still learning difficulties. In girls, symptoms usually appear as inattention without hyperactivity. They may stare out the window, seems dreamy, not disruptive, poor focus, perfectionism, anxiety, spend hours on simple tasks, fear of mistakes, emotional sensitivity, cries easily, feel rejected quickly, develops low self-esteem. She may think she's lazy or dumb. She tries harder but still struggles, which reinforce self-blame. Now let's say ADHD symptoms in adulthood. In men, most common sign is chronic procrastination, low dopamine signaling, inability to start tasks without urgency. Person may know for weeks that something must be done, but only start the night before the deadline. Second most common sign is extreme inconsistency. Dopamine spikes only with novelty or strong interest. Another sign is impulsivity. Person may interrupt others mid-sentence. Many adults ADHD consistently seek dopamine. This may appear as speeding while driving, gambling for excitement, alcohol or substance abuse to relax, extreme sports or other risky behavior. For women, ADHD symptoms in adulthood looks different. Most common sign is chronic anxiety. She consistently worries about forgetting something, missing details, or making mistakes. The anxiety frequently masks ADHD. Another major sign is exhaustion and burnout. She works twice as harder to stay organized and may say, I'm tired all the time. The third most common sign is emotional dysregulation. She may easily cry. Emotions can shift rapidly and feelings experienced very deeply. At the same time, they are often disorganized at home and chaotic, even despite real effort. Emotional binge eating is common. This happens during stress or overwhelm with strong cravings for sugar or fast emotional relief. Weight fluctuation is also common, and depression is also very common. People with ADHD have some major advantages compared to general population. For example, in entrepreneurship or self-employment, successful compared to general population. They have strong business creation, not long-term stability, but novelty, high risk, and rapid decision-making creates a dopamine-rich environment. Also, they are highly creative, divergent thinking, non-linear thinking. They have hyper-focus or passion and novelty are common because fast reward cycles. They are good in programming. Also, they can be good athletes. And in media and entertainment, such as content creation, YouTube, filmmaking, and performance and broadcasting, because in ADHD, it can be advantage because consistent novelty, fast reinforcement, and creativity are rewarded. For the treatment, most effective treatment is methylphenidate. It increases dopamine and norepinephrine signaling, and it's very effective, usually 5 to 10 milligrams twice daily. It's considered most effective and safe for long-term use. Also, amphetamine-based medications are even more effective. However, they are associated with higher risk of side effects, such as appetite suppression, sleep problems, and cardiovascular risks. In adults, second-line treatment may include atomoxetine, guanfacine, and bupropion. Atomoxetine is non-stimulant medication, and it's very effective also. It's selective norepinephrine reuptake inhibitor and increases dopamine indirectly. And bupropion is also effective. It is dopamine and norepinephrine reuptake inhibitor, and it is useful in ADHD, especially when combined with depression and when stimulants are not allowed or not tolerated. And guanfacine is alpha-2 adrenergic receptor agonist, and it mainly helps with impulsivity and emotional control and weaker effect on attention. From supplements, rhodiola may have some effects, some benefits because it slightly increases norepinephrine and dopamine and serotonin signaling. However, it's not selective for the prefrontal cortex, which is key brain region involved in attention deficit. This is why effect is small and not strong enough to be included in clinical guidelines. Among other supplements, omega-3 fatty acids also have some benefits if taken regularly, especially on emotion and emotional attention and emotional regulation. However, they have mild effects and they are not equal to stimulants. Yes, effective treatments. Besides medications, cognitive behavioral therapy also is important, which helps usually procrastination and time management and task initiation. And regular aerobic exercise have its important role. Sleep regulation is also important because poor sleep worsens attention and impulsivity. And for children, parent training is important, changing the environment, reducing punishment cycles, and using structured support instead of constant discipline significantly improves outcome, even without medication. The focus is on support and structure, not punishment.